Okay, so sorry this becomes part two. So I was talking about the May 2003 GAO report. Also, then in 2005, the Congressional Research Service report cautioned about the H5N1 avian flu pandemic, that if it actually was to become a pandemic, then the victims would require intensive care and ventilation support exceeding the national capacity to provide this kind of care. Same month, Department of Health published a pandemic influenza report, influenza plan, that said in a severe pandemic, it's possible that shortages, for example, of mechanical ventilators will occur and medical care standards may need to be adjusted to most effectively provide care and save as many lives as possible. Well, the fact of not having sufficient ventilators and different things actually caused an ER doctor to die this week. He caught the virus, died in the arms of his husband just a few days later. And so it's this adjustment. It's tough to see that adjustment for some people is something that has no personality, has no real connection to people. But in the reality, it absolutely does. In 2006, a report by the Congressional Budget Office stated that the U.S. has approximately 100,000 ventilators. 3/4 of them are in use at any time. And that if there was a pandemic like the one in 1918, that would require 750,000 ventilators. So I noted that. In August 2006, of the Defense Department's implementation plan for pandemic influenza, consideration should be given to stockpiling instead of just-in-time acquisition of an adequate number of ventilators, antiviral drugs, and other things, including the PPE, protective equipment. 2007, Interior Department pandemic influenza plan, health care facilities will be overwhelmed, creating a shortage of hospital staff, beds, ventilators, and other supplies. 2009, Occupational Safety and Health Administration publication, healthcare facilities can be overwhelmed, creating a shortage of hospital staff, beds, ventilators, other supplies. August 2009, Executive Office to the President, related to preparations for the H1N1 outbreak, and said 1 to 2 of every 2,000 Americans might be hospitalized, requiring 50 to 100% or more of the total ICU capacity available in the United States, placing great stress on a system that normally operates already at 80% of capacity. 2015 study, researchers from the Department of Health and Human Services for Disease Control and Prevention modeled the need for ventilators during influenza outbreak, calculating an additional 7,000 to 11,000 ventilators would be needed, and averting a pandemic, another total of 35,000 to 55,000 deaths, but that a clinical attack rate, 30% rate, a high severity scenario would indicate then a demand for another 35,000 to 60,000 additional ventilators to avert a pandemic total of 178,000 to 308,000 deaths. What we're seeing today is that it's even worse, and in this kind of situation, I mean, this disease is really goes fast. It's unbelievable that it affects people like it does. You notice, like Chris Cuomo, he talks about the things overnight that were going with him, the chills, this kind of thing, really just unbelievable. So you have all of these things. I won't go into like Hannay and all those who blah, blah, blah about it and everything like that, about Trump saying, oh, well, the governors are just being whiny and complainers. No, they need to be done. They need to be built. They need to be made. And the U.S. government needs to get doing it. that concludes all of the reports that CNN had available in their March 27, 2020 report, showing that all of the reports that itself had already been done, indicating the need for ventilators. Thank you very much. Hope you're doing well.